In this video, I'm going to explain the treatment process. Then communication with parts and the basic treatment plan are presented. After a review of the treatment method, I explain how the subconscious treats the trauma over the duration of the trauma. The pain intensity treated and a pause between treatments are two variables used in the treatment plan for each part. I explain the integration of parts and the safeguards of treating fragile parts. I describe how to contact the subconscious and to problem solve to deal with barriers for communication with treatment. This is all described in Chapter 3 of A Theory and Treatment of Your Personality, which you can download from www.garyaflint.com, my blog site. The advantages for the main personality getting treatment are that he or she will get more happiness and have less pain. The main personality will also no longer experience intrusions, have any lost time, or dissociate important information. All the parts can run the body from morning to night with no conflict. In addition, studies show that fully integrated people having a mono-personality are more successful in life. In this treatment, I educate all parts so that they know what is happening and agree to common goals. The subconscious will do the treatment, but the treatment method will not be taught to the subconscious until all members of the treatment team agree. Recall that we amass an autobiographical memory. Traumas at different times can cause personality parts. The main personality can be amnesic of these parts. In this section, you will learn about the subconscious treating and integrating the personality parts. When I communicate with parts, I explain that I want them to join a treatment team that will give me permission to teach the subconscious how to treat pain. I remind them that we all want more happiness and less pain. Treatment is a painless process. I don't need to hear their trauma history, but will listen if they want to share. Members of the treatment team want treatment, want to have their positive self-empowering behaviors strengthened with positive emotions, and want to integrate with the main personality. They agree to work in consensus when setting treatment parameters for each part on the treatment team. This is an educational process to convince the parts to join the treatment team. The subconscious treats the pain a little bit at a time. I offer more safeguards so the parts do not flood the main personality or feel pain. After integration, they can run the body full-time with no conflict and get more happiness and less pain. The subconscious orchestrates the trauma part to put a safe amount of pain into the active experience. The rest of the pain stays outside of the associative barrier. The subconscious treats the pain in the active experience carefully. The subconscious treats a safe intensity of pain across the duration of the trauma. The intensity of pain treated is held constant. The time for the pain is adjusted to hold the intensity of the pain constant, as trauma pain intensity changes over time, say from high to low. The rate of treatment is a fixed unit of pain treated each time, see the figure. The treatment team and the subconscious create treatment plans for each part on the team. All treatment team members have to agree on each treatment plan consisting of the unit of pain and the rest time. Each plan has its own rate of treatment. When the stimulation of parts reaches a certain threshold, they will flood the active experience. To prevent flooding, the subconscious treats them to a safe point and then rest. The rest time is a treatment parameter. The subconscious treats the part's pain before integration. Its positive self-empowering behaviors have been strengthened with positive emotions. With integration, it joins the main personality in a union of memories by sharing memories back and forth until the part and main personality have identical memories. This usually strengthens positive behaviors and weakens negative behaviors. The memory of the part fills in the amnesic space in the main personality's history. Dissociative memories of both remain dissociated. If the part thinks its trauma will hurt the main personality, the subconscious can dissociate the trauma memory of the part during the treatment. When the subconscious integrates the part and the main personality, I believe they share their memories back and forth. The other integrated parts also share, so all parts have identical memories. After integration, they can all run the body at the same time without conflict. Some parts are afraid they will experience too much pain or flood the main personality. To prevent this, I ask the subconscious to move 4 parts somewhere in the brain and cluster them together. The space in the center protects active treatment from other brain activities or stimulation that may trigger the part to flood the active experience. The space between the parts is a protected space in the brain to treat the fragile parts. Besides the protected space for treatment, I have more interventions that ensure safety while treating. 1. I ask the subconscious to treat the associative and dissociative processes at the same time. Extreme trauma often damages these processes. This also gives the subconscious better control of the pain treated. 2. I ask the part to back into the active experience. This reduces or cancels anticipatory anxiety. 3. I ask the part to wear a boa, leotards, or a diving suit to hold them together so they won't fall apart. 4. I ask them to hold the hand of the creator or a significant other to give them security. At this point, I tell the parts that I won't teach the treatment method until all parts are on the treatment team and agree to it. I communicate with the subconscious using finger responses. Index fingers means yes, thumb means no, middle finger means I don't want to tell you, and the little finger means I don't know. I ask, can I talk to your subconscious? Sometimes I get a yes, and sometimes I get a no or no response. When I get a no or no response, either now or during treatment interventions, I problem solve. I ask, can I talk to the part who's blocking communication? With either a yes or a no, I ask, is there a consideration blocking you from speaking with me? With either a yes or a no, I ask questions about common barriers. Here are some examples. Are you afraid the pain will be too great? Are you afraid that you will die? Do you fear losing your knowledge, wisdom, and understanding of life? Is there a pre-birth part interfering with communication? Do you want more pain and less satisfaction? All 17 reframes are given for 17 different barriers in Chapter 3, pages 75 to 87. When you believe that all parts are on the treatment team, ask, do all the parts on the treatment team want the subconscious to learn the treatment method? With a no, you continue problem solving to get all the parts on the treatment team. When you get a yes, you use an oncology check from NLP to make sure. You ask, do you mean that there are no parts that don't have any objections to my teaching the subconscious the treatment method? This question confuses personality parts, and they answered no. When this happens, you problem solve and treat the parts until you get a yes. In my experience, the subconscious gives a yes when all the parts are on the treatment team and want the subconscious taught the treatment method. Once all the parts are on the treatment team and the subconscious is taught the treatment metaphor, I ask the subconscious and the treatment team to create treatment plans for all members of the treatment team. They all vote in consensus, which means that all parts have to agree on the treatment plan for each part. This protects the wee baby part from being afraid when the subconscious treats a part with extreme pain. Once the treatment plans are completed, I ask the subconscious to treat the parts in the best order and in the best way. The patient usually feels the process start with a sensation occurring somewhere in the brain. In this video, I presented the steps one has to take to convince all parts to join a treatment team. Then, after an ecology check, I teach the subconscious the treatment method. The problem-solving interventions shown in this process are used constantly in treatment. As with EMDR and EFT, one intervention fits all people. The same is true of this treatment method. I use these interventions with all people, but further treatment needs problem-solving to customize the interventions for the person. All people have unique autobiographical histories. The memory structures of traumas created can be unusual and need creative problem-solving. I am still planning Part 6 in this series. You can download this material presented in Chapter 3 from either my blog site at www.garyaflint.com or from www.neosolteric.com. Thank you for watching.